All right, thank you very much. Yes, it is true Mbale Referral Hospital faces a lot of challenges. As was already highlighted, we serve a catchment area of 16 districts and 1 city, which is the largest catchment area for any regional referral hospital. We serve a population of 4.5 million people, which is the largest population that any regional referral hospital serves. In addition to that, we have challenges with the referral systems and also the functionality of many of the lower-level health units. As a result, we find we are getting a lot of referrals. As the name says, we are supposed to be a referral hospital, but we find ourselves also sometimes serving as a primary care hospital, meaning we are dealing with all conditions right from the lowest to some of the most complicated. This has caused us to serve a large number of patients that sometimes we may struggle to deal with, which has often resulted in some of those complaints of sometimes poor service delivery, of sometimes lack of supplies, and many other complaints that are related to that. So this health assembly is intended for us as stakeholders to get together and see how we can discuss the challenges we face and come up with solutions. And I also intimated the fact that many times we discuss many of these challenges among us as health workers only. Yet we often do realize that we need to engage other stakeholders. For example, the political leadership in the districts, the RDCs, the COWs, so that they can help us to address many of the challenges that we face. So as a regional referral hospital, our mandate is slowly evolving. Previously, we were just a standalone center providing palliative care, but now our role has extended to providing technical support and sometimes oversight to many of the health facilities within the region. And our hope is that working together with the districts and our partners, we can improve the functionality of many of these facilities at the lower levels, such that we can be able to expand the care that they give, improve the quality of care that they give, and therefore reduce the need for patients to be referred to and always come to Mbale Hospital crowding the hospital. We believe that if this happens, we shall all have a manageable load and the situation in this region will improve.
What has been
logistical challenges? I'm sure many of you are aware of the challenges that national medical staff has faced. This sometimes has resulted in late deliveries. Of course, also the large number of patients we serve is more than was originally planned for Mbale Referral Hospital. And as a result, this has led to some of the stockouts that you hear about. Yes, there is a need. That's why we are trying to work together with the means to see if we can improve their functionality. For example, there are a number of health centers that should be able to do operations, that should be able to do cesarean sections. If this is done, obviously this means that the need for referral becomes less. Yeah, of course, you have also seen our large population and heard from the minister. Perhaps there is a need to think of another referral hospital in this region, and I'm aware the ministry is seriously thinking about that and taking that into consideration. My message is that we should work together as partners to see how we can improve the healthcare service delivery in this region. I'm aware that we deal with a number of partners, we deal with a number of stakeholders, and they have useful ideas, they have useful additions, and I think rather than only concentrating on the criticisms, we would like to work together with them and see, since they are stakeholders, what can we do together to improve the service delivery in this region. Of course, the message as a health worker, myself, another message I would pass along is prevention is better than cure. If you have looked at our hospital statistics, you will see, for example, in the recent past, we had a surge in the number of cases of malaria. In this region, we had a particular type of malaria called black water fever, which was causing us a lot of headaches, a lot of admissions. The need for blood transfusions was high, creating a lot of shortages. But malaria and many other diseases are preventable. So we need to do more to prevent these diseases and stop people having to come to hospital.
Thank you. Your name's